Thank you, Dr. Omer. Dr. McCullers, welcome.
Thank you. Good morning, Chairman Alexander, Ranking Member Murray, other members of the committee. My name is John McCullers. I'm the Chair of Pediatrics at the University of Tennessee and the Pediatrician-in-Chief at Le Bonheur Children's Hospital in Memphis. As someone who has devoted his career to the child health sphere, I truly believe there's no more precious resource than our children, and they should be protected by all means available to us. They really are the future of this nation. The childhood vaccination program in the United States has proven to be one of the most powerful public health achievements in our history. In the first half of the 20th century, there were more than 1 million infections and more than 10,000 deaths every year in this country from diseases which are now preventable by childhood vaccines. Measles alone caused more than 500,000 illnesses every year. Measles is a highly contagious viral respiratory disease characterized by fever, cough, sore throat, and a rash. It is a very dangerous disease. About 1 in 1,000 infected persons develop encephalitis, an infection of the brain. 1 in 1,000 develop severe pneumonia, and about half of those with those severe complications die. There is no specific treatment for measles, so vaccination is the only means of preventing these outcomes. With the introduction of a safe and effective vaccine for measles in 1963 and improved public health efforts to see that nearly every child received it, new cases of measles arising in the United States were entirely eliminated by the year 2000. Unfortunately, the issues of vaccine opposition and vaccine hesitancy are now impairing our ability to effectively ensure coverage, aided by state laws that make it easier to avoid vaccination. The last decade has brought numerous outbreaks to the United States, including several that are ongoing at present. These outbreaks are strongly linked to vaccine refusal, and in particular to clustering of unvaccinated individuals in specific communities or regions. This problem is not limited to the United States, however. Countries worldwide are dealing with similar outbreaks. As a single example for the committee, there were 0 cases of measles in Brazil in 2017, but more than 10,000 cases occurred on a countrywide level in 2018 when infected travelers brought measles into that country. The vaccine against measles is very safe and very effective. 1 dose provides complete protection in about 93% of individuals, while a second dose raises that level of protection to 97%. Very few side effects occur. About 1 in 10 children experience fever for 1 to 2 days after vaccination, and about 1 in 3,000 to 1 in 4,000 have a simple seizure associated with fever with no lasting effects. Allergic reactions are very rare and typically very mild. When compared to the outcomes of the disease itself, it's easy to see why doctors and public health officials universally recommend on-time and complete vaccination. Unfortunately, vaccine refusal is high and getting worse in many states. This issue is complicated by the variety of state policies regarding exemption from vaccination and the methods of counseling about vaccines. The rate of parents claiming non-medical exemptions is about 2.5 times higher in states that allow both religious and philosophical objection. Evidence seeing that multiple pathways for exemption really worsens this problem. Social media is now driving a new phenomenon somewhat distinct from vaccine opposition, termed vaccine hesitancy. When parents get much of their information about health care issues such as vaccines from the internet or from social media platforms such as Twitter and Facebook, reading uninformed opinions in the absence of accurate information can lead to really understandable concern and confusion in these parents. They may be hesitant to get their children vaccinated without being provided with more information. The role of the pediatrician is very important, therefore, with these families. We must do a better job of communicating at many levels, but particularly at the point of contact at the well-child visit when vaccination should take place. About half of the time, when counseled appropriately, parents with vaccine hesitancy will agree to have their children vaccinated on time. And the other half, little seems to help at that stage, so the solution must be earlier, either in the form of policy or broader educational efforts. In closing, I'd like to thank the committee for addressing this important issue. Vaccine refusal is one of the growing public health threats of our time. If we continue to allow non-medical exemptions to vaccination, the rates of vaccine will continue to fall. More outbreaks will undoubtedly follow. As a leader at a children's hospital, I have a unique perspective on this, as children's hospitals are regional and sometimes national resources. Le Bonheur Children's Hospital sits in the corner of Tennessee next to Arkansas and Mississippi. These 3 states all have very different policies for granting exemptions to vaccines, which creates a tremendous problem for us and a threat to the children we serve, many of whom are too young to be vaccinated or are immunocompromised and more prone to severe diseases. I urge the committee to consider solutions that will both harmonize public health policy in this area